Hello, everyone. My name is Ashley Slight. I am a public health and health security consultant with Constant and Associates. We're a healthcare consulting firm that specializes in emergency and disaster preparedness based out of Torrance, California. And we work primarily on training, assessments, exercises, and plan writings, specifically for a wide variety of healthcare facilities, but also public health departments, private sector organizations, and nonprofits. And I'm here today to walk you all through a template that we recently developed in conjunction with the California Primary Care Association. And this template focuses on pandemic operations. So we developed this pandemic operations plan template for community clinics and health centers in California to achieve a couple of different objectives. One, we wanted to provide you all with a walkthrough of a potential plan if you don't already have one, especially those of you who may have been developing some plans and policies around the ongoing coronavirus epidemic. So we wanted to walk you through what a pandemic plan looks like so that you can maybe translate some of your existing plans or policies into a more comprehensive pandemic plan. We also wanted to give you a plan template that could be used for other large-scale public health emergencies. So the idea with this pandemic operations plan template is that it's not just specifically for coronavirus, even though we are releasing this during the COVID-19 ongoing response, but we want this to be a template you can access any year and develop the same types of response elements for other public health emergencies like an influenza pandemic, maybe a large-scale measles epidemic, any large-scale public health emergency that might affect your facility. A lot of the same elements and considerations we're going to walk through today can be similar for any of those public health emergencies. So you'll notice that the template itself, even though I'm going to refer a lot today to coronavirus, the template itself does not refer to coronavirus specifically, except for one of the appendices, which is more of a reference document. We also will go through in today's webinar just a couple of recommended plan development areas. This includes risk assessments, continuity, patient care, demobilization, and recovery. And this is just to give you a structure of what we recommend in a pandemic plan. We'll touch on a couple of things like the CMS emergency preparedness rule and how organizing your plan in a certain way can help you to meet those requirements. And we'll touch on elements that you may not have already considered in your pandemic plan. So whether you already have a pandemic plan and you're just looking to improve it, or if you have just a bunch of rough draft policies on a paper for coronavirus, we're hoping you can get something out of today's presentation. The plan template itself should supplement your existing emergency operations plan. And so this can be added potentially as a hazard-specific appendix to your EOP, or it can be a standalone document, just a separate pandemic operations plan. Either way, generally with plans and policies, we recommend that if it's going to be less than 30 pages, you should consider it as a hazard-specific appendix. If the document is going to be more than 30 pages, consider making it its own standalone plan. But either way, with your emergency operations plan and your hazard-specific appendices or other standalone documents, they should all tie together. Many of you are familiar with the Centers for Medicaid and Medicare Services Emergency Preparedness Rule requirements. One of those is to have a comprehensive emergency operations plan, but it also requires that you have plans and policies in place related to your top risks and hazards. And pandemics or any infectious disease outbreak are one of the top hazards on health centers' risk assessments generally. So your EOP, as part of the CMS rule, needs to be the foundation of the rest of your emergency preparedness program. And that doesn't change for today's walkthrough of the pandemic operations plan template. It needs to be tied in with your emergency operations plan. So whether you're starting this document from scratch or you already have a pandemic operations plan and you're just looking to improve it, we recommend that you also review it in tandem with your EOP and make sure that they're aligned, that they are based on the same foundational elements of emergency management, they reference the same plans and policies, just to make sure that they're not contradicting each other. And that way, if a CMS rule surveyor or auditor comes to your facility to look through your documents, they're going to be looking for alignment in those plans. And if you've already considered your EOP while you're working on this document, you should be fine. So the rest of this webinar will really focus on a walkthrough of the template. I'm going to toggle back and forth a little bit between the slides and the actual document itself, just to give you an idea of how to use it and some recommended elements of the plan. So first, let's touch on instructions. There are going to be a couple of areas and icons in the plan template to help you customize it for your own use. You'll notice the first one, we use this pencil icon throughout the template for any area of the template requiring customization by plan writers. We also use brackets and gray highlighting for any section of text that needs to be customized for your facility's name and information. And we've included a series of tip boxes for further review, generally just for the plan writer to consider, maybe areas you can pull in additional information or reference material. And those can be removed as you're going through the document and as you finish each section. So quickly here, I'm going to go to the document itself. So this is the actual plan template itself. You'll notice that we have some sections where you can insert the name of the planning team, the name of any executives who may need to approve the document, who may need to review it, and records of any changes going forward. So this is meant to be a template you use first to create a plan or update your plan, but then a plan that you'll also maintain and update at least annually. And you use these tables to keep track of that. So you'll notice in general we have these icons, these pencil icons anywhere that you might need to continue to customize or update. We have those brackets, as I mentioned, for anywhere where you can insert specific information such as your facility name, positions, titles, things like that. And then we also have a couple of those tip boxes that I mentioned, just sprinkled throughout the document to help you pull in some relevant information. So I'll come back to the document once we go through each and every section, but I'm going to pull you back into the slides for just a second. So pulling back, we have a couple of planning steps for your community clinics or health centers to consider as you start this project. We are recording this in the era of coronavirus, so some of you probably already have a committee or a planning team in place. Maybe it's an emergency preparedness committee, a plan development committee, or just an ongoing task force responsible for coronavirus policy making. So if you do have an existing multidisciplinary committee or planning team, have them work to review this template and identify gaps in information, or if you already have an existing plan or a draft put together for coronavirus specifically or for another response, for example, maybe you had a seasonal influenza outbreak plan from a couple of years ago, you can have that committee just identify areas of this template that can help supplement your existing plan, or things you can copy and paste over, things you can supplement, things you can insert. So we definitely don't mean for this template to be the end-all be-all of pandemic operations plan writing. We want you to use the template to either supplement anything you already have in place or just to provide a structure to organize what you have. We also highly encourage you to coordinate with other health centers and your local healthcare coalition specifically to use existing resources and plans. Some of them may already have a pandemic operations plan or a coronavirus response plan for their facility, and they are going to have tailored information already for your jurisdiction, maybe based on your local public health department's plans and policies. So please work with your coalition members or your other health centers locally to see what they have, what they can offer you, and what you can offer them for their plans. We also encourage you to add some specific appendices and reference information throughout the document. So when we come to the end, I'll go through this one more time, but you can use some of those sections to insert vendor agreements, for example, that are specific to your health center, or text for telephone triage, You can insert specific forms. So we really highly encourage you to use those appendix sections to insert as much facility-specific information and policy as you can. We also encourage you to review a draft of the plan with representatives from different positions and departments in your facility to gather some different perspectives. Oftentimes we see, because health centers are so busy and everyone is so taxed as it is, especially right now, that there's one person who's assigned to do the plans, to do the documentation, and other folks simply don't have time to review the document. And while we completely understand that, and our goal is not to add work to your plate at this point, it really is important that you have multiple perspectives on a plan like this. I'm sure many of you have already come across this with coronavirus or with previous infectious disease outbreaks, but you need folks from facilities, from the medical treatment side, from administration to fill in the gaps. So as much as you can maybe piggyback on a staff meeting, utilize an existing file sharing network, those types of things to get as many different perspectives and voices to provide input on the plan as possible. That will really serve you in the long run. And that's also something that CMS Emergency Preparedness Rules surveyor, when they come down a year or two from now, that's something they're also going to look for. How many people provided input on the plan? How many people are trained on the plan? So the more you can document that ahead of time and get that input, the better it will serve you later on. And finally, we mentioned just making sure you establish an update schedule and maintenance responsibilities for the plan. Make sure someone knows they are responsible for looking at it once a year, making sure it's updated, making sure that it contains updated contact information, for example, and make sure that it's included in training content for staff. So again, going back to the CMS rule, all training content really needs to be based on that emergency operations plan and any hazard-specific annexes or other plans. So if this pandemic operations plan is going to be part of your operations, it needs to be part of your training content as well. So I know that sounds like a lot, and certainly not all of those steps need to be accomplished immediately, but these are things you should start to think about for the pandemic ops plan, as well as any other plans you're developing right now, especially if you are working on coronavirus-specific plans and documentation. So now that we've sort of set you up with some recommended next steps for documenting your pandemic operations, we're going to talk through a couple of key elements of the plan template itself. Some of these you may already have in other plans, or some of them you haven't considered yet, and this is your opportunity to take a look at what we have in the template. Maybe it can supplement your existing documents. So we've organized the plan according to these sections: risk assessment, pandemic phases summary, continuity, patient care operations, demobilization and recovery, and then the appendices. And within each section, we have sort of an introduction and some key considerations that we'll go through in the rest of this webcast. But first I want to start with a recap of the pandemic phases. This is according to the World Health Organization's Continuum of Pandemic Phases. They have 5 main phases: interpandemic, alert, pandemic, transition, and interpandemic. And a lot of times when we're writing a pandemic or an emerging infectious disease response, we like to organize our response according to these phases because it gives us a helpful timeline to mark our response efforts against. Throughout the whole process, you have risk assessment. That's an ongoing phase. We're going to talk about that in a bit. And it also matches with the preparedness, response, recovery, and preparedness cycle as well, pretty much. Right now, at the time of recording of this webcast, we are in the middle of the coronavirus response. And right now, I would say, if you are listening, we are still in the pandemic phase. I know there's been talk of a second wave, but we are still technically in the first wave and in the first part of pandemic response. So we would be right here in the middle in that pandemic phase. One thing that's helpful in the template that I think a lot of people can gain from is we included a table of considerations for community clinics and health centers specific to each phase of a pandemic. So some of this has already passed if you're looking at this for just coronavirus, but this will be helpful for you in general for any future pandemic or large-scale public health emergency. And for each phase, we've included some actions that a community clinic or a health center should consider. So in the pre-pandemic, inter-pandemic phase, this is preparedness action. Things like making sure you have security plans for your buildings, you have stockpiles of personal protective equipment, and you have good infection control practices. Once you hit that alert phase, it's more transitioning into things like communication with staff, patients, and families, activating a committee to determine when and how you're going to alter services if there are cases in your area, considering canceling employee travel, monitoring local public health department website daily for guidance, things like that. Then when we move into the pandemic phase, we have a couple of actions here. Many of you are already engaged in these types of things, but convening a committee daily to see if any modifications in services are needed, conducting case finding, contract chasing, or reporting, limiting non-urgent surgeries and procedures, implementing access control, etc. So I won't read through all of these, but there is this table within the template itself, and the goal here is to give you a starter table of actions for your staff to consider in any phase of a pandemic. And we highly encourage facilities, if you're using the template, to further customize this. Add specific actions into each phase that maybe you've done in the past or you've figured out would be helpful to do next time around. So then we move past the risk assessment and pandemic phase section of the plan template, which really focuses more on giving yourself and your facility an overview of the pandemic phases, what infectious diseases are most at risk in your community, and what your patient population looks like. All of that will go in that first section of the plan template. So if I switch here, you can see we've already touched on the pandemic phases. There's a brief description here in the template of those phases and that table that we just went through. So here in the operational continuity section, we have objectives. We have a series of sections, including orders of succession, essential business functions, workforce protection, etc. And each of these sections is highly customizable for you to include some information about your daily continuity. With the continuity section in particular, hopefully many of you already have a continuity of operations plan or a COOP. If you don't already have a COOP plan, there actually is a CPCA continuity of operations plan template that you can also download and use. So I highly encourage you to do so if you haven't already. But a COOP plan is really meant to help you in any hazard or any emergency to identify essential business functions and how to keep those services running. Specifically here in this section of the pandemic operations plan template, you don't need to rehash your entire COOP plan, but we need to include some foundational details from your COOP planning to better set a foundation for the pandemic plan response. So we do need to have a couple of key elements from your COOP plan, like orders of succession, like key business functions, staff and mental health policies, for example. So rather than go through each of these sections in detail, I'm just going to point out a couple of those key areas here in the slides. So with continuity, I want to talk briefly about orders of succession and delegation of authority. There is a table that we adapted from the COOP plan template that hopefully you have something similar to this already, or maybe just verbally with your staff you have sort of informal agreements for succession. But especially in a pandemic, it is especially important that if a staff member gets sick, if you have high absenteeism rates, if a staff member has to take care of sick family members, or if you start to lose elements of your workforce, that you know, it's especially important that you know who can step into which role and when. Some of you with coronavirus have seen this already and have seen the impacts that it can have on your organization, staffing-wise. So for every key position in your facility, you should really have the position, for example, the director, the order of succession, who can take over for that person, a deputy, and then maybe the finance manager, and what authorities are delegated to that person. So, for example, if the deputy director took over for the director, which functions can they complete? All. Or if the finance manager has to step into that position, they can complete all non-medical functions. You don't necessarily have to have this table for each and every position at your clinic or facility, but you really need to have it for each key function or each key position. So executives, department heads, anyone who's specifically responsible for a task that maybe no one else is trained to do, that's another one that you want to make sure is included in an order of succession table. And there are other COOP resources out there to help you if you need to find examples of orders of succession for other community clinics or facilities. This is also one of those areas that is really helpful to reach out to other health facilities in your healthcare coalition because they likely have their own COOP plans. They likely have their own orders of succession that you can modify or use as an example. Then we move on to essential business functions. So this is also a critical piece of your COOP plan that really does need to be part of a pandemic operations plan as well. And this could be specific to pandemic operations. So while your COOP plan might just have, in general, here are the essential functions we perform, here are the critical ones, here are some other services we offer that we can suspend, and you can move on from there. But with a pandemic operations plan or a coronavirus specific response plan, you need to identify what's feasible essentially during a pandemic response effort. So right now that could be services that can be performed remotely. It can be services that are considered critical functions or essential functions as defined by local public health. So you may find that some of your COOP plan essential functions may not fit exactly into your pandemic or coronavirus essential functions. And that's why you really need to have a committee or a couple of people to establish what are the critical essential business functions now in the midst of this pandemic. And a couple of essential, critical, other type of functions that really is going to vary by each facility type. But again, reach out to your coalition partners, your other health centers in your community. They may already have a list of this. Some of you may already have considered this months ago for coronavirus. And it's really just a matter of putting them on paper. So you have those for reference for a future outbreak. The rest of the sections we have in the template for the continuity section are workforce protection, modified services, for example, and then the other categories that you see here. These are all considerations that you should have in any pandemic plan. So some of you already have a coronavirus response plan or some policies you've created, and they might be very comprehensive, but I highly encourage you, even if you already have a response plan, to look at each of these categories and figure out where there might be gaps. Certain things like the use of volunteers, that can be especially important later on for CMS rule surveying. They are going to look at your vendors, your volunteers, your contractors that are on site and how they responded, how they were engaged, what type of communication you had with those folks, not just your general day-to-day employees. So I highly encourage you to go through each of these categories almost as a checklist to see if you do have a current plan, whether your plan already addresses these. And either way, you can then go through our template here and consider copying and pasting some of the text over to an existing plan or building it out further here within the template so that you can use this going forward. We have a couple of examples here for telemedicine. I will just point out that that is really facility specific, the degree to which telemedicine is going to be used. So you'll notice that some of these sections here really are highly customizable, and that's simply because we cannot put in a template exactly what telemedicine policies or what modified operating hours and service policies will be put in place. That's another thing for you and your executive committees to put down on paper and to discuss as a group. We also have virtual and telephone procedures listed in here. This will depend upon the facility, but we did include some direction here for activating telephone telephone triage and triage evaluation during a pandemic. So this is usually one of the first things that's implemented in any outbreak, where a health center or a community clinic can basically evaluate patients over the phone before they come into the office, so that they're not a risk for so that they're not a risk to expose other patients to the disease. So in addition to this section here in the plan, there actually is an appendix later on in the template with a sample telephone triage form and a script for your reception staff to use. You can modify that however you'd like. Some of you may already have telephone procedures or telephone triage. Highly encourage you to work with your public health department on that as well. They may have example text for you. So going back into our slides here, the next main section is patient care operations. This is where likely you all already have some text to begin with. Continuity might be lighter, risk assessment, those are things that most facilities maybe have thought about but maybe haven't quite put down on paper yet. But patient care operations is usually the meat of where a lot of facilities already have written policies and procedures. So once again, we just encourage you to go through each of the sections of the template as sort of a checklist and see if you've addressed each of these areas, either for coronavirus or for another potential future outbreak. So the first section in this patient care operations plan template is surveillance. This is really how you're going to monitor the potential spread of a disease. So this is engaging in things like assigning someone to monitor local and state surveillance reporting every week or maybe every day. Assigning someone to create and implement a screening form for all your patients who call in with particular symptoms. Providing a copy of a human resources policy about how to report symptoms for staff members. All of these surveillance elements are part of a pandemic operations plan, and you likely already have some of this figured out, especially for coronavirus. But it's really just about putting it all in one place within this plan. Next, we move on to infection control. So a lot of this is going to revolve just around making sure that you have just-in-time training and refresher information for all of your staff. That can be in staff meetings, that can be in training, but you want to make sure all that training material is put down on paper in the plan or in the appendices so that you can pull it out whenever there is risk of a second wave, potentially, of coronavirus or any other future outbreak. So we've hit surveillance, infection control. Some of the other sections in the patient care section are surge capacity, behavioral health and psych first aid, appointment desk triage, staff and patient vaccinations, and patient education. So going back to our plan template, one is standard precautions and personal protective equipment in general. What we've done is listed the standard contact, droplet, and airborne, as well as the full barrier precaution levels within the plan as a reference. And it'll be up to your facility to determine what the triggers are for different precaution levels of personal protective equipment. Just as a tip, oftentimes when we see large pandemics or outbreaks, the Centers for Disease Control and Prevention, the CDC, or OSHA often will come out with some guidance about personal protective equipment, but it's usually a little delayed. So for example, with coronavirus back in January, when we were still starting to see inklings of the virus coming into different communities, we didn't have solid guidance yet from CDC and OSHA. And that's partly because with a new virus or any new disease, they're still working on it themselves and learning a lot about a new outbreak or a disease. So what you really need to do in your plan as a facility is to establish a base level of precaution recommendations based on different disease types. And you need to play it safe. You need to basically overcompensate with personal protection levels until further guidance is released. So throughout this entire section, we have language that the following table, for example, outlines general precautions until further guidelines are released from public health authorities. And that's the case with any infectious disease response or emergency. But until you have that guidance, which does get delayed in many cases, it is good to have a documented, foundational plan. So we have some general infection prevention guidelines here in this table that you can use just as is if you prefer, or you can modify this a little bit more if you and your staff have gone above and beyond with maybe some other policies. But for example, we've listed a precaution type like infection control recommendations, standard precautions for all patients, and droplet for patients with symptoms of the disease of concern. We have respiratory cough etiquette. We have isolation precautions. We have family member recommendations. So there's a whole list here. Again, I won't read through each and every one, but this is a good solid start for any plan or small facility who maybe doesn't know how or where to start with general infection prevention guidelines. The next few sections, these touch on a couple of other considerations that you may want to provide a little more detail on. Surge capacity would be anything that you're able to do to convert maybe some of your facility for isolation or additional patient care, maybe use an outdoor clinical evaluation area, maybe partner with other healthcare facilities or canceling certain appointments. Anything you can do to basically provide that surge. As an example, I mean, during previous influenza pandemics, we've seen roughly 50% of people who are sick who seek medical care. And of those, at least half tend to seek care in an outpatient medical care setting. So you will see surge in any environment where there's a large-scale public health emergency. Then we sort of move on to behavioral health and psychological first aid. This tends to be one of the most ignored elements of any pandemic plan or response plan, and some of you may have been on top of this already for coronavirus, in which case I applaud you, but many facilities simply feel like they don't have time to get around to this or they don't know how to approach it. So this can be as simple as starting just by making sure you have someone or a position in charge of monitoring staff for signs of psychological distress. You can also have check-ins with healthcare staff on any symptoms or signs of exhaustion. Burnout tends to be a huge element of workforce decrease in a pandemic. So it's just assigning a position to be responsible for sort of monitoring and documenting some of these things, and then putting some resources in place for staff, which your facility may already have some resources that you can tie back to. We also have some helpful reference material here on what stress looks like during an infectious disease outbreak. Usually looks like fear and worry about your health or the health of loved ones, changes in sleep or eating patterns. I'm sure many of us are already experiencing this in the ongoing coronavirus response. Interestingly enough, nightmares about catching the disease is another common stress symptom. Any worsening of chronic health problems or chronic health symptoms, and increased use of alcohol, tobacco, other drugs. All of these are just signs of stress. And you have sort of folks or segments of your patient population who may be at more risk of experiencing these stress symptoms. We have children and teens, older people, and people with chronic disease, those who are involved in the response, including first responders and healthcare workers, and anyone who has mental health conditions, including problems with substance abuse. So we have some language here to identify those populations. We have some tips for your staff and some resources they can connect folks to. We highly encourage you to also add to these sections any specific HR policies you have for your staff regarding mental health and behavioral health, or just maybe your leave policies, maybe your sick day versus vacation day policies, administrative leave policies. Things like that can be really helpful to beef up here in your plan. We mentioned appointment desk triage before. This is repeated in this section just as a reference point. So I won't go into that one in detail, but I do want to mention staff and patient vaccinations as well. We have seen, even right now during the coronavirus pandemic, that the California Department of Public Health is really pushing and reinforcing seasonal influenza vaccine for all staff and patients. So this upcoming fall, it'll be especially important for folks to get their flu vaccine to prevent more surge on the healthcare system and to just hopefully limit the number of people who are in a healthcare waiting room who might be exposing other folks to coronavirus. So with any pandemic, in general, you want vaccines to still be a huge part of your response plan. That's for staff and for patients. And it's not just seasonal influenza vaccine. For example, with coronavirus, when a vaccine does finally become available, your facility will likely need to coordinate with the local health department to figure out what is the likelihood that you'll receive doses of that vaccine. If the vaccine is new, there's probably going to be a very limited supply initially. So your public health department is going to want to know who are your priority or essential functions. Again, going back to the continuity section, who are those priority positions? How many personnel do you have to vaccinate? And then making sure you have a plan in place to administer that vaccine to your staff and then maybe even to your patients if you're able to get to that phase when there is vaccine available widely for your patients. One of the appendices we have here in the template is a sample vaccine clinic layout. So if your facility has never done a vaccine clinic before, like a large-scale vaccine clinic, we have a sample layout in the appendices, and there's also additional reference material you can pull in from the CDC that we have in the just-in-time training section of the appendices. And that gives you more information about how to run a large vaccine clinic. And that can be whether it's for your patients or for your staff or for maybe healthcare responders, first responders in your area, anyone like that. So that's another area you might want to consider building out further in the plan. For all of those of you who already have maybe a coronavirus response plan, this is an element that I think a lot of people have not thought about yet. How we are going to prioritize vaccine, how we're going to administer vaccine. So start having those conversations now and start looking at those CDC reference materials and the layout in the appendices here. Start having those conversations to build out those policies now rather than later. Finally, we have a patient education section. Many of you probably already have some public messaging guidelines related to coronavirus or some of the other previous outbreaks you've had in your community. So making sure that if you have a crisis communications plan or some message templates, make sure those are mentioned here. Make sure you know where those are located so anyone can pull those out and you know what languages are spoken, what materials need to be provided, when patients should be advised about cancellations or missed appointments. Those types of things need to be included here. Going back to the slides, so we're on the second to last section, which is demobilization and recovery. With pandemics, there's really two areas here. There's transitional planning, and then there's evaluation and after action. Transitional planning is once you hit that transition phase, when we start to see the number of cases has consistently decreased over a period of weeks with no signs of reemergence. Again, we are not in transitional phase yet for coronavirus. But you want to start to take a look with this template or with your existing plan at what your transitioning planning will look like. So your facility will need to monitor your local health department advisories as part of normal operations and day-to-day work, but you also will want to look at what your triggers are for a transition. That would be a couple of things here we've included as samples, like a steady decrease in the number of new cases, vaccine becomes available, or any other treatment methodology. Federal, state, or local entities have indicated that it's time to transition to recovery, or maybe some other triggers that you might have for your facility specifically. You also are going to have to prepare for the possibility that not all your staff will be able to return to work as normal when you return to day-to-day operations. So if you do have a function or a service that's been canceled or put on hold during an outbreak, once you bring it back, you may not have all your staff to bring back to that function. So you want to put some plans here in place for hiring temporary workers, maybe quick surge staffing capabilities, maybe a vendor or a consultant to help you bring in staff quickly, maybe mention your volunteer program, anything to help you sort of cover this transitional phase. We do tend to see that a lot of healthcare workers who experience burnout during pandemics, they often will make it through the actual response period, and burnout will really start to hit during this transitional phase. And that's where you see folks who may quit, who may leave, who may not return to work. And that's really why it's important for the transitional phase to have some sort of backup staffing plan in place. You also might want to consider drafting a recovery plan or transition plan specifically for the outbreak. So while this template will help you put some triggers in place and some general guidance, if you are putting together a specific coronavirus response plan, or in a future outbreak, let's say an influenza response plan, make sure that you might have an appendix or a part of that document that's specifically about recovery for that disease or for that outbreak. And you can always cut and paste this section of the template to use as a base and then further customize. Then the last section that we mention here is evaluation and after action reporting. Evaluation can really take place throughout response and recovery. It doesn't have to wait until you've transitioned back into normal day-to-day operations. Evaluation can be ongoing. Even now during coronavirus, there are a lot of facilities having a monthly red team meeting, for example, a monthly debrief as part of a staff meeting to outline strengths and areas for improvement. And what you want to just make sure is that you have a plan for documenting those things and coming back to them at the recovery and transitional phases. So once you have your notes throughout the response of those corrective actions that were taken, of those areas for improvement that were noted, you want to take those notes and make sure that you have them maintained for later reference and that you have one or two positions who start to work with all that documentation and schedule a formal after-action meeting or a debrief with the staff once you've transitioned into recovery. And that person or that team will really use the after-action report as an opportunity to identify larger structural areas for improvement and then also potentially use that to get grants and funding for later implementation. With the after-action reporting, just make sure that you give all of your staff an opportunity to provide feedback. It really is important for critical incident stress debriefing and psychological health in general for them to have an opportunity to reflect and to contribute and feel like they're providing input and their voices are being heard. So we're moving on to the end of this document. Just with the appendices, as we mentioned before, this is another great section to make it all your own. Include copies of your own facility policies. Include samples of your contact lists or your messaging templates. Make it as customizable as possible. However, I do also recognize that a lot of you don't have a lot of time and may not have some of these things in place, and that's okay too. The template is here for you to use as a starting place. And we have some sample appendices already in the document to provide you with some reference information. The good or the bad thing, I guess, right now with coronavirus is there is a lot of resource material available out there. There are a lot of people putting out guidance every week. And so some of that you might want to have maybe an intern or a volunteer start to put together a folder somewhere of documented resources and materials coming out of the CDC, the World Health Organization, NIH. Any of these organizations, just start to collect those resources. You may need them later on, and you can add them to plans like this or maybe even your emergency operations plan. But just so that we don't overwhelm you with references, we've picked a couple that we think would just be helpful in the interim. One is just an infection prevention points template. So this basically for different precaution levels has some standard personal protective equipment guidance in this table. And this is just a generally easy to cut and paste table that you can use on signage and posters. We also have the coronavirus 10 tips to protect employees' health from the CDC. This is coronavirus specific. However, these can really be spread out to any large-scale public health emergency. So we felt this was a worthwhile reference to include just in general. It's a good place to start in a pre-pandemic phase in terms of how to protect your staff. I mentioned earlier we have a sample vaccine clinic room layout and flow diagram. This is just to help you if you do need to set up a room to administer a vaccine. And to go along with it, we included some of the CDC's vaccine storage and administration guidelines. So this is a link to their main page, but you'll see they have training, they have tools, they have videos, they have skills checklists for They have skills checklists for vaccine administrators, anything you could really need to implement a vaccine clinic at your facility, whether that's for just for your personnel or for your patient population. Then we have a couple of customizable appendices that we encourage you to take a look at. Certainly contact lists, and this is specific to if a suspect case is identified, if a patient calls in and reports a positive diagnosis, if someone reports feeling ill, or if they have an ill family member, who is the contact and what are the guidelines? Vendor agreements. This could be things like if you have a 24/7 sanitation or cleaning contract for upgrading environmental cleaning at your facility during a pandemic or an outbreak, maybe a pharmaceutical agreement or a point of dispensing agreement if you have one of those with your local health department. All of those are agreements you'll want to include here as a reference. And then we have forms, so anything that you have form-wise specific to an outbreak like coronavirus or maybe a past influenza outbreak, you want to include some of that as sample material here. So we have an example that we've included for an appointment desk telephone triage form and message template, and that's here. This is just a generic version that you can use to start with, or you can insert your own forms. Could be symptom evaluation, telephone triage, any messaging templates that you have here. And finally, the last one we've included for you all in the template is some sample just-in-time training materials. So if there is an outbreak that's ongoing or coming up, a couple of things you can use to refresh your staff on personal protective equipment, psychological first aid, incident management, and just the CPCA website in general, keeping an eye on that for future templates that they develop, future tools, webcasts, virtual webinars, all of that can continue to help refresh your staff. So we did our best to keep the template to about 40 pages. Hopefully that's not too much for a lot of your facilities to start with and to use as a base to create one comprehensive plan. I know a lot of you have already done a lot of this with coronavirus specifically. And so I hope that you may have some of these appendices and reference materials you can easily cut and paste into the document, that it's not too overwhelming to use a structure like this template to put together just one comprehensive plan. We really want you to work backwards from any written policies or procedures you might already have. Build in some planning for other potential public health emergencies. Don't just limit it to coronavirus. Think about the future seasonal influenza season. Think about maybe measles or other outbreaks in your community that your population or patient population might be at high risk for. And lastly, just as another final reminder, make sure that the template or any plan you develop ties in with your emergency operations plan, that it's consistent. And all of these things will help you to meet that CMS rule requirement, to make sure that your plans and policies are ready to go at any moment in a pre-pandemic phase, and that you have the documentation you need for grants and for funding reimbursement later on for response. So I really appreciate you all going through this webinar with me and with the walkthrough of the template itself. I'm available at any point if you need some technical assistance. My email address is listed here, as is our website. And we really hope that this template serves as an opportunity for you to shore up some of the informal plans and policies you already have started on. And if not, hopefully you can share your best practices with other healthcare coalitions and facilities. Thank you all so much. Have a great day.